Thank you for joining me today. My name is William Reisacker, and during the next several minutes or so, we're going to be talking about allergen selection for oral mucosal immunotherapy, or OMIT. So here we are in New York City, my hometown in the early 1900s. I have to say it looks a little bit different today, but believe it or not, this is when allergy immunotherapy got its start. At first it was given only through injections under the skin, but very quickly it was discovered that allergies could also be improved long-term by placing those concentrated allergy extracts against the lining of the mouth, where antigen-presenting cells are in very high density. This location for delivering immunotherapy has been shown to be very effective and even safer than injections, so it can be done from home. And one of the ways to get those allergy extracts to a large area of the mouth is by doing something almost everyone does each day: brushing their teeth. The treatment period for allergy immunotherapy is only about 4 years, but the benefits last many years into the future. So in a way, immunotherapy is like sending your immune system to college, where it learns how to be less sensitive. Most people on this treatment report less symptoms, less medication use, the medications they use work better when needed, and their quality of life is overall improved. These benefits begin during the first year of treatment, but it's important to finish the full course to hold on to those benefits as long as possible. Allergy immunotherapy does not affect the body's ability to fight infection. Allergy immunotherapy is a particularly good option for young children with allergies. It has been shown to prevent the development of asthma later on, as well as the development of new sensitivities to other allergens in the environment. If you see a patient with possible allergies who you feel might benefit from allergy immunotherapy, it's important to ask about the types of symptoms they are having and how well medications have worked for them in the past. Itchiness in the nose, throat, and eyes, along with sneezing and runny nose, are very reliable indicators that they are suffering from allergies. But they may also report fatigue, nasal congestion, and frequent severe upper respiratory infections or even asthma attacks. It is also important to find out when during the day and the year they are having the worst symptoms, and whether they feel better when they are indoors or outdoors. This information will help you decide which allergens should be included in their OMIT treatment pump. So let's meet some of these allergens. Pollen allergy is extremely common. The further south you go, the more extended the pollen season becomes. Trees, seen in the upper photo, pollinate during the springtime, and because they have low cross-reactivity, it's reasonable to put a few trees into the treatment pump. Grasses, on the lower left, pollinate during the summertime, and because they have high cross-reactivity, I only put one grass in the treatment pump. Weeds, on the lower right, pollinate in the fall and have medium cross-reactivity, so more than one can be added. It's helpful to learn which allergens are common in the area where you practice. Dust mites are microscopic members of the spider family and feed on proteins shed from human hair and skin. They thrive in areas where we spend a lot of time, such as couches, carpets, and beds. They are overall the most common indoor allergen, and if a person is sensitive to them, they should most definitely be included in the treatment pump. As with all of the other allergens, it's important to discuss with your patient how to decrease environmental exposure to them, particularly if allergy immunotherapy is being contemplated. Pets are very common in our households, and when your patient is allergic to them, it can have a major impact on their quality of life. Most cats share similar allergenic proteins, but with dogs, there is more breed-to-breed variability. It's also important to remember that pet fur can trap other allergens such as pollen, mold, and dust mites. If a person is sensitive to cat dander, I will almost always include it in the treatment pump. If a person is sensitive to dog dander, I will usually only include it if they are living with a dog, are contemplating getting a dog, or have significant exposure to dogs outside of the home. Mold is ubiquitous in our environment and can be both an indoor and outdoor allergen. Levels of mold spores spike in the early spring, late spring and fall, sometimes leading the clinician to believe that their patient is allergic to pollen. Mold is common in older buildings, after renovations or water leaks, and in locations where there is moisture, such as kitchens, bathrooms, and basements. If I believe that mold is playing a significant role in a person's allergic disease, I will usually include no more than 2 of them in the treatment pump. It's important to remember that high levels of mold spores can lead to nose, throat, and eye irritation, even if a person is not allergic to them. Before we move on to selecting allergens for the treatment pump, just a word about air quality. Besides allergies, there are many environmental factors which can produce symptoms that look exactly like allergies, like chemicals, odors, pollution, excessive particles in the air, or even fluctuations and extremes in temperature and humidity. This should be part of the discussion when you test a person who you are convinced has allergies, only to find out that they are negative to everything. For those people with allergic as well as non-allergic sensitivities, immunotherapy may still be helpful, but it's difficult to predict. After you have the results of allergy testing and your patient is ready to start OMIT, the next step is to decide which allergens should go into the treatment pump. It's not recommended to go down the entire list, adding every allergen that has tested positive. My goal is to include about 6 to 8 of the allergens that I feel are most clinically relevant for my patient based on all of the information that I've learned from them. It's not recommended to include allergens that have tested negative, and the allergens that comprise the treatment pump usually are in the mid to high positive range. So far, there is no universal agreement concerning the ideal number of allergens in the treatment pump, but there is concern that large numbers of allergens can create too much competition for immune cells in the mouth and lead to breakdown of the allergenic proteins. The allergens in the treatment pump can always be changed in the future, depending on your patient's situation and the progress they are making along the way. Thanks for listening.